Losing 5 to 10% of your body weight in a few months without trying, if you are sleeping well, eating well, and still feel unusually drained for weeks, this kind of fatigue is seen in conditions like leukemia, colon cancer, and in some cases due to chronic internal blood loss. If your bowel movements or urination habits change significantly in frequency, urgency, or consistency, and it is ongoing, don't ignore it. If these symptoms are there, you have to take it seriously and do what is required. Hello, I am Dr. Anil Kamath. I am a senior consultant surgical oncologist at Therapy Healthcare. In cancer care, early detection saves life. This is not just a phrase, it's a fact. The challenge is early symptoms often don't look like cancer. They can be subtle, non-specific, and easily mistaken for everyday issues like stress, infection, or aging. Today, I'll walk you through early cancer symptoms that should never be ignored. Let's begin with unintentional weight loss. Losing 5 to 10% of your body weight in a few months without trying is something we always investigate. It can be linked to cancers like that of the stomach, pancreas, lungs, or even sometimes blood cancers or lymphomas. Sometimes it is the body's first response to a tumor before any pain or swelling begins. If this happens, we recommend basic tests and imaging, not to panic, but to rule out something serious. Next, we feel tired, but cancer-related fatigue feels very different. If you are sleeping well, eating well, and still feel unusually drained for weeks, or if basic tasks such as feeling exhausted, it is worth discussing. This kind of fatigue is seen in conditions like leukemia, colon cancer, and in some cases due to chronic internal blood loss. It is not about feeling sleepy. It's a type of deep exhaustion that doesn't get better. The next symptom of cancer is a lump or swelling that does not go away. Another sign that needs attention is a new lump anywhere on the body. It might be in the breast, neck, underarm, groin, or even a limb. If it is firm, growing, or still thereafter a few weeks, it's worth scanning. Lumps could be harmless or could signal breast cancer, lymphoma, or soft tissue sarcoma. Now, let's talk about pain. Chronic pain is often treated with painkillers or physiotherapy. But pain that does not improve with basic treatment, especially in the bones, the back, pelvis, or abdomen, could point to deeper tissues. For example, bone pain in young people could suggest a sarcoma. Abdominal pain could be related to cancers, say like that of the ovary or gastrointestinal cancers. If the pain is staying or getting worse without a clear reason, it needs a deeper look. Some cancers speak through your digestion long before any other signs show up. If your bowel movements or urination habits change significantly in frequency, urgency, or consistency, and it is ongoing, don't ignore it. Blood in the stools or urine, constipation, alternating with diarrhea, or feeling like you can't empty your bladder, these can be points to colorectal cancer, bladder cancer, or prostate cancer. It is especially important if these changes last for more than 2 to 3 weeks. Another early sign that gets overlooked because it is blamed over a minor infection is bleeding. Unexpected bleeding should always be taken seriously. This includes bleeding in between the periods in females, bleeding after menopause, coughing out blood, or blood from the nipple, that is nipple discharge, that isn't normal. Now, these symptoms of bleeding may point towards a cancer such as a cancer of the endometrium, of the uterus, lung cancer, or breast cancer. Bleeding that is not clearly explained by injury or infection always deserves testing. And finally, if swallowing becomes difficult or your voice becomes hoarse and stays like that for several weeks, it could be more than throat infection. These are symptoms which can be seen in head and neck cancer, esophageal cancers, and sometimes even in cancer of the thyroid. If the food feels stuck or your voice does not come back to normal, these symptoms require investigations and do not delay your checkup. So what is the best time? What is the time you should see a doctor? So in general, the rule is if the symptom is new, if the the symptom does not go off even after 2 or 3 weeks, or even after going, it keeps coming back, these are the symptoms which you should not ignore, and you should visit a doctor to get it investigated further. At the same time, I must tell you that not all of these symptoms mean cancer. In fact, most of the cases it will not be cancer. But if these symptoms are there, you have to take it seriously and do what is required, that is, undergo proper checking. And this makes all the difference. At therapy, we don't just treat the disease. We help people navigate their symptoms with clarity, compassion, and clinical precision. We offer rapid access to imaging, blood tests, and consultations. A multidisciplinary team of top oncologists, radiologists, and pathologists, evidence-based guidance, and support that respects your time, dignity, and emotional health. We are here to help you understand what is going on and act early if needed. You deserve clear answers and a care team that takes your concern seriously. So let's take that first step together. Thank you.